Hi friends, I want to say something about surgeoncut.com. Lot of doctors, surgeons, dental surgeons, other medical professionals world over have been regularly asking us for videos that YouTube doesn't like to show to people because it has a lot of blood content and it's the way we do surgeries. So we've got this website now up and about. You can subscribe, you can learn how we do these surgeries exactly. No editing, but in good clarity, 4K clarity. So all the best and thank you. ചെയ്യണം നമ്മളെല്ലാം അന്ന് കണ്ടിട്ട് സ്കാനിങ്ങും മറ്റ് ഡീറ്റെയിൽസും എല്ലാം പറഞ്ഞിട്ടുണ്ട്. അപ്പോൾ എന്നാ ചെയ്യണം? ഓപ്പറേഷൻ എന്ത് ചെയ്യണം? എല്ലാം റെഡിയാക്കി. ओके सो इनको बुला के वो स्प्लिंट दिखाओ. शो मी. हाँ करेक्ट.
सर मास्क करना
വേണ്ട. This is after 5 mm, is it?
Yes, sir. This is his original bite.
Each other. So I just have to check the amount of twist that he needs to have. The midline is moved one tooth.
Yes, sir.
So why don't you just correct this one tooth?
So, sir, we can correcting.
Once again.
This is how intermediate is coming, sir. Now, when we're doing, it's coming more on this side. Like almost. We're keeping this, sir. Then this to this is 9 mm and this is like 2.
If you keep it like this.
We kept like this and made final split. This line matching here and this line here. But intermediate is here, so this distance is less, like 2 or 3 on this.
But he's got good occlusion, right? And he's got this lock. You should keep it like this. I think because the kadichomone. That's fine. I mean, you see, it's still a little bit towards the left. That's fine. And then he can. അപ്പോൾ മോൻ ഓപ്പറേഷൻ കഴിഞ്ഞ് 1-2 മാസം കഴിഞ്ഞിട്ട് ക്ലിപ്പ് ഇടണം. അത് ഞാൻ പറഞ്ഞിട്ടുണ്ട്. വീണ്ടും കണ്ടിപ്പായിട്ട് ഇടണം. ഇല്ലെങ്കിൽ ഈ പല്ല് കണ്ട എങ്ങനെയുണ്ട്, അതാ ഡോക്ടറിന് ഡൗട്ടാ. അപ്പോൾ ഇന്നലെ എനിക്ക് അയച്ചിട്ടുണ്ടായിരുന്നു, പല്ല് കുറച്ച് ടച്ച് ചെയ്യുന്നുണ്ട്. അപ്പോൾ നമ്മൾ താടെല്ലാം റെഡിയാക്കിയിട്ട് നാട്ടിൽ ചെന്നിട്ട് നിങ്ങൾക്ക് ഒരു ഡെഫിനറ്റ് ആയിട്ട് ഇടണം. ഒരു 6-8 മാസം ഇടണം. മനസ്സിലായില്ലേ? ഗോ അഹെഡ് വിത്ത് ദിസ്. ഓക്കെ, ഒന്നുമില്ല, വേറെ ഒന്നുമില്ല. അത് മാത്രം ഡൗട്ട് ഉണ്ടായി. അതിപ്പോൾ ഡൗട്ട് ക്ലിയർ ആയി. ഭക്ഷണം കഴിച്ചാ? കഴിച്ചിട്ടില്ല. ഓക്കെ ഓക്കെ ഓക്കെ, റെഡി ചെയ്യാം.
Hello everyone, we are here with this young man. He's come for something, a genuine problem for his jaw problem. Now when we say jaw, the problem is with the upper and the lower jaw both. And as we see, he says his jaw is very forwardly placed, it's V in shape, it doesn't look very aesthetic. When we see the concern intraorally, just bite and show us how you're biting. Yes. So this is how his bite is. Just bite and maintain. Yes. So the audiences can clearly see that the upper jaw is inside and the lower jaw is outward. It's quite outwardly placed. Hence we see that the lower teeth are inside. We have something we call as an underbite or a reverse overjet. Now, along with it, the defect is a little complex. I say complex because when we see a facial midline, the upper teeth seems to be a little towards his right, and the lower teeth, this happens to be his midline, which is towards his left. So that defect makes the defect a little complex. Bite is the concern, the facial symmetry is the concern. So if he turns on one side, we see the profile, it's a typical concave shape profile, wherein a retrognathic maxilla and a prognathic mandible results in this. It's going to be a bi-jaw or a 2-jaw surgery with an intubation for him, probably a submental intubation. MMF wires will be placed for him. A mock surgery has already been done, scans have been reviewed. So it's a lot of work pre-operatively, intra-op obviously, and even post-operative the care has to be adequate such that he can go back home safely and without an uneventful, like with an uneventful recovery period. Also, there's a possibility for post-surgical orthodontics that the patient has already been counseled about. So let's see how this surgery goes. Thank you.
Just say hello. 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 I'm going to sleep.
I'm going to sleep.
Yeah. You get a good view of Malayan. The car to look so okay. Cute photo. Cute. Yo, sterile. Are you sterile? Okay, good. So why you are wearing that? Getting ready for the case. Will you do the symmetry?
Yes, sir.
Start a bimaxillary surgery here. It's a face makeover. We're getting the upper jaw forwards, rotating it a bit downwards, like a clockwise movement. This is the patient's occlusion, and this is how the patient is before we start. You can see that how the underbite is so severe. The upper jaw is also hollow, as you can see. There's also asymmetry, if you can see now. The chin is moved towards one side of the patient's face because one half of the condyle has grown more than the other. So we're going to be taking care of all of this. Actually, I can hold it. Can you make a hold of the distance? With this major face makeover, underbite correction or protruding jaw surgery, we're going to show you how he looked before. I'll show you the front view. So you can see his teeth was not visible. He had a very long lower jaw that was deviated and not symmetrical. That has been fixed. I'm going to show you how his side view looks now. So he had a lot of, you can see that his upper jaw was way inside. We've brought it outside by 5 millimeters. We rotated it down so that he can have his tooth shown when he smiles. His lower jaw was way too long. You see, we've made it more proportional now. And we've given him anesthesia via submental route so the entire face is open for us for work. Okay. Different views.
Hello everyone, here we are with this patient post bi-jaw surgery, meaning a two-jaw surgery. Now I'll start with the dynaplast removal, so as to say. A little complex part, yes, that's because the hair is there. Okay Ashwin, we start from here. Soak it a little bit more. I'll soak it a little bit. I'll do it fast, little fast, Ashwin. Okay. You'll keep your head back behind. Yes, relax. Relax. Okay, done. Done. I'll do it little fast. Bas. Done. This part won't hurt you, Ashwin. Just keep your head back. This I'm going slow. Okay. Okay, we are done. Ashwin, I'll clean up a little bit for you. I know the sticker mark takes time to go. This tape also will be removed. This is because of the intubation. Okay. First thing first, have a look in the mirror. Okay, we'll come this side, sister. Okay, yes. The first most remarkable change that you see, Ashwin, is with respect to facial profile. When I say facial profile, I mean the way your upper and lower jaw was aligned. One look, you feel the facial proportions are not matching. Also, one very important thing, the chin was not in the midline. If you draw a line, say from your forehead, your nose, your nasal tip, upper lip, lower lip and the chin, you see it's all along a straight line now. You see in this picture, the chin was deviated towards your left. Okay. Another very important thing for our audiences and for you as a patient is your profile view. Now when I say profile, yes, you look towards your right and you see how your jaws were aligned. You knew this complexity. As you told, you were a very aware patient when you came. You said, I know I have a prognathic mandibles. You were using all technical terms, very well aware of what the problem is. But this profile is called a concave profile. Why concave? Is because your lower jaw is way ahead of your upper jaw. Now if you look on the side, your lower jaw is inside. It is how it should be. Like the upper jaw should ideally be ahead of the lower jaw by a margin of about 2 to 3 millimeters, and that is the case with you. This is after surgery, just 10 days, exactly 10 days post your surgery. Yes, you can see the jawline also now. See how extended your jawline was. Okay, I'll go on to show other views as well. You can slide, this is a 3/4 view. By 3/4 view, yeah, we've just taken the tape off and hence this oozing. That will subside. It was so there for so long. Yeah, I know. And we see this view. Yeah, we see there is swelling. I will not say swelling has come down completely. You're a lean person, so for you there is swelling, and even little bit of swelling is looking like this. So we see how the facial profile has become. Yes, you can see. You can smile now, Ashwin, and you can. I know everything is very tight for you at the moment, but see how the upper and the lower lips are resting. Try closing your lips with little bit of effort. Yes. See how the alignment is right now, and see when you would smile, there would hardly be any incisal display. By incisal display, I mean that there would be no teeth show, right? That's because you always, the upper jaw was behind, there was no fullness over here. It all looked, these are called as a nasolabial grooving. The lines were very prominent. Now it's all stretched. It also decreases age from your face. Okay.
This scar will gone?
There is no scar right now. These groovings are there which has become tighter. You see light bruising here below the eye. Those are all like scars. These scars will fade away. They're underneath your skin. They're just because of the blood clots and they fade away. One very important remarkable change I'll also show in this view. Why I say this view is because you see how your upper jaw was inside. There was no fullness here, which you can clearly see in this view, right? You can see the groovings. Your groovings are no longer there. It's become very tight now.
Looking nice. Get the front and side view. He's looking good. Oh yeah, that's amazing. Good, especially this view. Turn and look at that side. So there you see the improvement. So it's not just the upper jaw, but also the chin, lower jaw, everything. Good, right? We have to see. Kandile. He's from that side. Who's his father?
He's upstairs. He might have come on. I made him sit there. No, he doesn't know. I made that patient Snehanshu sit there and kept the tray. After this, I'll go. Okay, so we see the remarkable change in terms of bite. Yes, this is for you, Ashwin. This is yours. Your bite 1 week before. This is how your teeth were aligned or mal-aligned, so as to say. Now, why I say mal-aligned is because your upper jaw was inside, okay, and your teeth, if you see your lower teeth, they were moved to one side. They were completely shifted. Yeah. You see, this is your pre-op view. I'm sorry to say, this is his pre-operative picture. These are his upper teeth, and this is his lower. Now, the lower is clearly towards his left, was towards his left, so as to say. Yes, so this is how you used to bite. If you can just bite a little bit and show to our audiences. I know it's difficult. Keep a little down. I know it's difficult because of muscle movements, but we can zoom in and see whatever little we see. It's clearly jumped the bite. The upper jaw has come ahead. Yes, so this is how his bite used to be. I can show you side views. By side view, I mean the lower jaw was way ahead of the upper jaw. Yes, so this used to be his bite, happened to be his bite around 1 week back. We'll finish it off with the side view, the most remarkable one in terms of profile, in terms of symmetry, in terms of proportion. Ashwin, do you have anything to say? That's very important, because as a patient you have certain list of expectations, and you were one of those patients who were very well aware, who knew that what treatment lied, the treatment was surgical, everything you were aware of, you had done your research. How are you feeling now?
I feel very happy.
You're still there, yeah. Keep in touch with us, Ashwin. Keep sending us your pictures. I hope it will only improve from now on. Yes, swelling is there, but I'll say it's drastically decreased from what it was, say, immediately after the surgery. It will only be a smoother road from now on. Be in touch and keep sending your pictures. Okay? Yeah. Thank you.